Navigating the realm of infectious diseases can be daunting. Here's your concise guide from the first symptom to the final cure. Imagine you're faced with a potential case of tuberculosis, a complex yet common infectious disease. First step, diagnosis. Symptoms like a persistent cough, fever, and night sweats might point you there. Next, you'll need a definitive diagnosis. This is where lab tests come into play. A chest X-ray can reveal signs of tuberculosis, but you'll confirm the diagnosis with a sputum test, checking for the presence of Mycobacterium tuberculosis. Once tuberculosis is confirmed, treatment begins. The standard approach includes a combination of antibiotics, such as isoniazid and rifampin, typically taken for 6 to 9 months. It's crucial to follow the treatment plan precisely to avoid the development of drug-resistant strains. Remember, managing infectious diseases effectively requires accurate diagnosis, precise lab work, and adherence to treatment protocols. Stay informed, stay prepared. Music fades out.